So why is it important that organisations in health and social care are person-centred? I don't think that you can deliver personalisation in an organisation unless it's person-centred. Because person-centred practices are simply a different way to listen to people and understand what matters to them from their perspective and how they want to be supported. So unless staff are also listened to, and unless we know how to support staff in a person-centred way, how can we deliver truly personalised services? Because we're expecting staff to do something different to what their experience is in their support. So person-centred practices aren't simply a new set of tools to implement. They represent a fundamentally different way to be and to support people. And this has to start with leadership. In United Response, there was a regional leadership team who led by example and worked with managers to enable them to develop their skills and knowledge of person-centred practices. Because I think the role of the first-line manager is absolutely crucial here. They are key to supporting and coaching staff to make person-centred practices a habit in the organisation, simply the way we do things around here. And this also means really looking at the roles, tasks and functions of managers and asking what would they look like if they were truly person-centred. One example of this is the way that United Response introduced positive and productive meeting process to completely transform meetings and make sure staff really felt that they were listened to as well. So if person-centred practices are a different way of listening, this means we need to be thinking about how we can listen to and hear the views of people who use service in the way that the service develops as well. Traditionally, organisations are encouraged to do this through surveys and questionnaires, but obviously this is really limited and doesn't work for people who don't use words to communicate. There's a new and different way to do this called Working Together for Change, which is a way to co-produce learning at an organisational level by listening to what's working and not working from individuals, ideally through person-centred reviews. This means that through the review, we can ask people what their top 2 things that are working in their life, the top 2 things that aren't working, and the 2 things they'd like to change in the future. United Response was one of the first organisations to start to use Working Together for Change to develop their annual strategic plan, and continues to do so. We learnt that this requires courage and honesty. I remember the first time we did this, risk came up as a key issue. And Bob and I were surprised about this because United Response had recently redone their risk policy and redone their training. What we learned is it took much more for managers to feel confident in using a person-centred approach to risk. And we looked at different ways of doing this. How could we support managers to feel confident? How could we share stories of where things hadn't gone to plan and still staff felt supported? What else could we do? One of the ways that United Response did this was a commitment from Sue to staff that they'd be supported. And actually they went so far as to produce this, which is a guarantee of support for staff. It says, guarantee of support, act reasonably and we will support you. I think one of the other big achievements for United Response is embedded person-centred thinking and practices in their entire HR strategy. And I think that this was one of the ways that they managed to achieve the substantial reduction of 41% in their staff turnover.